Alrighty, awesome. Let me pull this up here. I'm excited that you guys can all be here tonight. I really appreciate that. I appreciate Michigan for Single Payer helping us organize up here. Um, my name is Jacqueline. I am the co-chair of Northern Michigan DSA, or Democratic Socialists of America. I'm here tonight with Eli Rubin from Michigan for Single Payer, Betsy Coffia from Grand Traverse County Board, and Greg Meyer, who is a local union member and also a member of the Democratic Socialists of America as well. Thank you guys for being here this evening. Um, and we'll kick it off. If you have anything you want to add to your intro there, go right ahead. And we're starting off this evening with, pull up my notes.
I think
Eli.
I think it's me. It's my turn. Yeah. So I'm not sure how many folks are watching or where they're at with, just like the movement and kind of what their involvement is, or knowledge. So I'll do just some quick background kind of on where things stand, and if it's stuff that folks already know who are listening out there, that's cool. Thought I'd just talk about the basic of the bill, of the Medicare for All bill, and kind of the idea of it, as well as the one in Michigan, and then just kind of talk about the current situation of where we're at, like politically, both in the state and in the country, and then just talk a little bit about the work that Michigan for Single Payer does, and is hoping to give folks a better idea, because oftentimes one of the main questions is like, well, what can we do? How can we get involved? So we have a lot of stuff for that. So Medicare for All, is an idea, but it's also a bill that's been introduced in the House of Representatives in Washington, by Pramila Jayapal and Debbie Dingell from Michigan, and is still waiting to be introduced by Bernie Sanders in the Senate. The key points, again, most people know this, but it would establish, free at the point of service universal health care. Everybody in the country would automatically get a Medicare card that could be taken to any participating provider, but almost all providers would participate. There would be no copays, there would be no deductibles, no premiums, no out-of-pocket costs whatsoever, and it would be an extension of Medicare to everybody, but it would also be an improved version of Medicare. So it would include things that Medicare currently doesn't include, like hearing, vision, eyeglasses, hearing aids, podiatry, and dental coverage as well. It would also cover long-term care. It would also, that including in-home care, as well as care at a facility, also would cover transportation to medical appointments, which is a big barrier for a lot of people. And then the latest version that's been introduced this year has put a lot more emphasis on racial justice, because one of the many things the pandemic has exposed about our broken healthcare system is the depth to which people of color don't trust it, and there's good reasons for that, but it has tragic consequences. And so providers like hospitals and clinics will have to take steps to prove essentially to Medicare that they are not, discriminating against patients of color or in any other way. And so, when people ask about how it will be paid for, the real answer, which blows people's minds, and for some people they just can't wrap their mind around it, is that it pays for itself. Actually, would save us money. If you imagine all the money that goes out of everybody's pockets towards health insurance in some way or another, whether that's through taxes to fund Medicare or Medicaid, or whether that's through premiums and deductibles, co-pays, or just other out-of-pocket expenses. If you think of that as all one stream, it adds up to, way more money than we would be paying if everyone just paid taxes, and then it was distributed equally and everybody got Medicare. So that's kind of the basics of what we're talking about. Every single industrialized country and a number of developing countries have some form of universal health care. All of them do it a slightly different way. Holland does it a little bit differently than England, who does it a little bit differently than Canada, who does it a little bit differently than Israel, who does it a little bit differently than Bolivia. But they all guarantee health care as a human right, not as something that you only get if you can afford it. So that's what we're aiming for. And then I should also add that Yusuf Rabi, the state representative who represents part of Ann Arbor, introduced in 2018 a bill to create universal health care in Michigan. And there are a lot of states that have these bills sitting in their state houses. Some states have come very close to passing them, such as Vermont. And New York State, I think, is currently the closest, or perhaps California or Maine. Minnesota is also close. So there's a movement to do things in the states, and the argument for that is that actually a lot of our biggest steps towards progress in our country's history happened at the state level first. That's, if you're someone who really loves our Constitution, that's one of the good things about it, is that states are like these laboratories. Women's suffrage, labor movement, marijuana, gay marriage, like all of that stuff happened at the state level first, and then it became a national thing. So, there is an argument for doing that. People should be aware that states can't do a true single payer because of the way that Medicare works and Medicaid. There's federal money that flows in, and things like TRICARE for active duty military or Veterans Affairs, veteran healthcare can't be co-opted by states. So it would sort of be more like a supercharged public option in Michigan, one where, we couldn't, unlike the federal bill, we couldn't basically say that no other insurance companies can compete with MI care, which is what Yusuf Rabi calls it. But not very many people would want to stick with their employer health insurance, frankly, if it were passed in the form that he's proposing. Because again, no copays, no premiums, no deductibles, and you can take it to any provider in the state, in network or out of network. So the current situation, where we're at right now at this moment, it's been introduced in the House in Washington. There's going to be hearings. Debbie Dingell has promised us, that there will be hearings. Some really great activists who were persisted for 2 or 3 years, who were part of an Our Revolution chapter in and around Asbury Park, New Jersey, put a lot of pressure on a guy, their congressional representative, a Democrat named Frank Pallone, who's the chairman of the Energy Committee in the House. That's the second most important committee, and one through which Medicare for All would have to pass. And they flipped him. So now he's on board with it. And that means that hearings are going to happen in some of the most important and powerful committees in Congress this summer. Our guess, we don't have a direct line of communication with Bernie. Maybe Betsy does, but we don't. We think that Bernie is waiting till sort of the drama is passed in the Senate with all this other stuff that Biden is trying to get done. Now, at the same time, Obamacare has just been reaffirmed once again by the Supreme Court, and this time I think it's pretty much for good. There's virtually no Republicans left who are interested in fighting this fight. They've lost. They know it. They knew it. And what that means is that then where a lot of Democrats were sort of like, they would say, we don't want to think about Medicare for all right now because we're still trying to defend what we've gained. We want to defend Obama's legacy. And I think there's a lot of people who are, real party loyalists who are sort of like not necessarily opposed to Medicare for all, but also saw it as a sort of movement of Bernie's to too quickly co-opt or supersede Obama. But now that that's fixed in place and there's no longer a need to defend it, I think a lot more people are willing to go the extra step and talk about universal health care, which, according to Obama himself, Obamacare was never meant to be the final stage of fixing our healthcare system. It was supposed to be a bridge to one day having universal health care. In general, in the Democratic Party, there's huge support for this, 85%. It's really only the most conservative Democrats, sort of most traditional, but also the wealthiest and the most powerful. It's sort of the people at the very top of the party are opposed to this, and everybody below them is for it. And we all know that has to do with, with donations and corporate donors. The second biggest lobby in Congress in Washington is the health insurance lobby. It's bigger than oil and gas. It's bigger than defense. It's bigger than Silicon Valley. It's bigger than Wall Street. It's second only to big pharma. So that's kind of what we're up against. That being said, there are discussions beginning now that Biden seems open to, and this is clearly Bernie's sort of inside game, is frankly incrementalism. He's trying to get Biden to put all his political weight behind extending Medicare benefits, so including hearing, vision, and dental, and possibly podiatry. I'm not sure, but also lowering the eligibility age to 60, which is something that a lot more conservative Democrats or moderate Democrats can get on board with, including probably our two senators. Debbie Stabenow has said this. Chuck Schumer has come out and said it. So this is probably where they're going to go next. And, our position as an org is probably where a lot of people are with this, is we're done with incrementalism. The only good time for justice is now. And we need to keep pushing, and they'll keep dragging their feet. But we've already pulled the center of gravity of the Democratic Party so far towards us. And not us alone, but the sort of coalition of all these groups, DSA, Our Revolution, even groups like Indivisible and national groups like Public Citizen or People's Action have really pulled everybody sort of towards them. And so what we do as an org, and first of all, we work a lot with DSA, we work a lot with Our Rev, we work a lot with League of Women Voters, with, progressive, anybody who wants to get out there and work for single payer. We're always up for partnering and doing whatever. We don't really care about the whole credit thing or anything like that. But we knock on doors and just do deep canvassing, just pick a neighborhood and knock on every single door. And, and we have these postcards that are very easy to fill out if people, are in fact in favor of this. We can give them a quick way that we'll just hand to Gary Peters or Debbie Stabenow or Gretchen Whitmer or whatever. But also we do just like tabling set up at a farmer's market or some other, festival. A lot of the stuff we haven't been able to do because of the pandemic, but we're going to be doing it this summer. But also lobbying, which in Lansing is incredibly easy. It's harder on the national level, but you can go up to Lansing and pretty much knock on anybody's door, and they're like lonely in there. The only people who come to visit them are lobbyists, so they're always happy to see you. And most of them don't know that much about the ins and outs of single payer. And then just a lot of public education, doing town halls, doing film screenings, public community meetings. Sometimes you can combine these things. You can do tabling or door knocking ahead of a community meeting and then pass out information for, hey, come learn more this Saturday at this location. And then another thing that we're going to be working on is what we call grass tops work. And I'll shut up after this, but that means sort of not necessarily lobbying the VIPs and the big decision makers, but talking to or even giving presentations to or enlisting the help of people who occupy an important or privileged part of the sort of, especially the Democratic Party ecosystem. And that means like faith leaders, that means unions, that means both leaders and locals, that means working with small and medium businesses who would benefit tremendously from single payer. And also it means municipalities. And I'm sure Betsy has a lot to say about this, but municipalities, counties, there's a campaign that we've been taking part in, a national campaign called the Public Citizen Medicare for All Resolutions campaign, where we try to get town councils, townships, county boards to pass symbolic resolutions in favor of the Medicare for All Act of 2021, which is important, though it's symbolic, because it shows when you go talk to a Debbie Stabenow, when you go talk to a Gary Peters or Gretchen Whitmer or some of these people, you can bring citizens with you and they can tell their stories and they will agree that the healthcare system is broken. But they're not going to see that as enough support. Think of it as like a pond, and you don't know how thick the ice is, and you don't want to be the one who finds out by, walking out onto thin ice. So you want to know, you want to have proof that there's a lot of support out there, that the ice is thick under your feet. And the way you do that is if you've got your core constituencies, so your unions, your churches, your business leaders, if they're coming out and telling Debbie Stabenow, you got to get behind this. We're sick and tired of the way things are with healthcare right now. Then you'll see the needle really start to move. So I'll stop there. I'll either take questions if they pop up, or otherwise I will pass it along to Greg, who is DSA Northern Michigan. He's also a union member. I should say I'm also a union member. This is a huge thing for unions. We're going through a contract negotiation right now, and it's the same damn thing it always is. Do you want to raise, or do you want to keep your premiums and co-pays where they are? And especially if you work at a place that's got, on average, older folks, who really do have to worry about healthcare costs and, co-insurance and co-pays and deductibles and stuff. Usually, and this is going to happen this summer too, I'm sure of it. They're going to say, we'll forego the raise. Just please don't raise our healthcare costs. And so we fall behind, and our real wages, decline. And it would be a glorious day when we and every other union could just go to that bargaining table and be like, raises and workplace safety. That's it. That's what we're talking about. We're not worried about healthcare anymore because it's already taken care of. So I'll stop there and hand it over to Greg, unless there are questions that pop up, and we'll handle them when they come.
I did want to interject. This is Paul. We did have some questions ahead of the webinar. I'll leave it up to you if you want to address these later. So far, we don't have any live questions.
Why don't we listen to everybody, and then we can get to some of those questions.
Sounds good.
If there aren't any others.
Awesome. So I guess I'll take it away then. And thank you, Eli, for that transition, talking about the importance of unions and fighting for Medicare for all. That was a pretty great segue. So I will introduce myself. My name is Greg Meyer. I am, along with Jackie, a co-chair in Northern Michigan DSA up here in Traverse City, as well as being a unionized worker in education. So as I start to speak here, I've had some recent Zoom connection issues occasionally. So just to be on the safe side, I am going to turn my video off just to make sure I can save some bandwidth while I speak. But I'll have it back on later. So I just to start off, personal connections between myself and healthcare. As I said, I'm a union member, and I'm very, very fortunate to have a pretty solid union healthcare plan. I am someone, as sort of a millennial age person, who spent chunks of my adult life uninsured. I was uninsured for a couple of years after college, and transitioning throughout jobs before where I'm at right now. Definitely have had gaps in coverage, and had many families have experienced those gaps in coverage related to work disruptions with COVID in the past year. So I've seen it impact my immediate family in some of those ways. And I think all of us have the same thing in common, where loved ones, people in our social circles, when they've been hit with large or more sudden illnesses, needing to go to a GoFundMe to get healthcare costs met, which I think is a pretty emblematic current example of just how unjust and unsustainable our healthcare system is at this point in America. Just historically, I think a lot of us already know, but back in 2010, at the beginning of, before we had the ACA in place, 48 million Americans were uninsured. Today, we have about 30 million Americans who don't have health insurance. And obviously the ACA has helped through Medicaid expansion and other things to really reduce that number. But I mean, given the fact that we're the richest country in the whole world, that is not nearly enough, and it's not good enough. And personally, as someone who's a democratic socialist, and a DSA member, I do believe that healthcare is a human right that people and that all people deserve to live lives of dignity. And this includes getting any care that people need immediately and without question of anyone's ability to pay. So I want to speak briefly to the popularity of single payer healthcare. This is a policy proposal that is extremely broadly popular among the American electorate and all Americans. I've seen recent polls that say upwards of 70% of Americans support this, and that's across party lines, which is a pretty astonishing fact when we consider like how divided we are in terms of when we think of red states and blue states. You know, this is not a red or blue issue. It's a absolutely imperative moral issue that 70% of Americans support. And I think that's very telling to how urgently we need to get this done. But yes, I wanted to speak briefly about the importance of labor as it relates to achieving single payer healthcare, because the big question is, you know, how do we get there when this is something that seems like such an insurmountable thing for us to accomplish? Historically, you know, we always talk about unions as being sort of a tool for change. In previous decades, you know, unions have been completely instrumental in earning working people the weekend, ending child labor, you know, putting in place a 40-hour work week, an 8-hour workday, unemployment benefits. So just some of those core labor rights pieces unions have been instrumental in historically. Here now in 2021, you know, we have the fight for 15 and the fight to raise minimum wage. Currently, unions are at the center of that struggle. That raising the minimum wage to $15 an hour is something that AFL-CIO wholeheartedly supports, and locals and national unions on the ground have been fighting for this. So just the role that unions play in economic justice has been huge, and it really needs to be more so active in battles around healthcare justice. You know, unions do have this natural role in these fights, but I do think that labor needs to play a bigger role in demanding Medicare for all or single payer healthcare in America. There are some institutionalized forms of support in organized labor. There's what is called the Labor Campaign for Single Payer, which is currently a coalition of unions around the nation, both locals and nationwide unions. Some of the more major players that are involved in the Labor Campaign for Single Payer include NNU, which is National Nurses United. So obviously professional workers working in the healthcare industry see that this is imperative and see that this is something we need. In addition, NEA, National Education Association, supports the Labor Campaign for Single Payer, as well as UAW and other major nationwide unions. An area that can be improved upon, I think, is just some of the actions of nationwide labor leaders. For instance, Richard Trumka, the president of the AFL-CIO, has been a little more hesitant to express support for single-payer healthcare. And his explanation for that is he and others, including Randy Weidengarten with AFT, sort of point to, you know, the fact that unions do have very high-quality healthcare plans that they spend a lot of time and energy bargaining for. And, you know, like in a world where we have the Janus decision in 2018, in a world where Michigan and other states have right to work laws, unions really do need to point to these, to union healthcare, which is very high quality, as kind of like a chip and a motivator to get people to join unions. You know, that's one of the major benefits of a union is the healthcare plans usually are pretty solid, lower deductibles, lower copays, lower premiums, and much more affordable. So a lot of national labor leadership, in what I feel is just more of a short-sighted way, points to the fact that, you know, like we want our union negotiated healthcare plans folded into a Medicare for all system. Otherwise, it's tough for us to support it. And I do think that that's something that that local unions and union activists need to push, is that just sort of that change in messaging from national leadership. Because that above argument it really is nothing more than one of those pro-corporation propaganda tools kind of being used to appear pro-worker. And I know that's not the way that leadership means that, but yes. So in addition to that, I just think that labor has to show solidarity, not just with union members, but American people at large. You know, like the labor movement has always had the rallying cry of an injury to one is an injury to all. And, you know, the fight for healthcare, I don't think is any different. just wanted to talk briefly about, comparing union healthcare to single payer healthcare. This is a point that I think Eli already hit on quite well. Unions at large spend a whole lot of time, energy, and resources negotiating and battling with employers over healthcare plans and healthcare benefits. And in a way, like this can lead to wage stagnation because it puts unions at a major bargaining disadvantage. Sort of like Eli, again, put it very well, unions with Medicare for all or single payer, unions would have a lot more time and leverage and energy to be able to fight for things like higher wages if battling over healthcare was taken off the table. So that leads us to that big question of where do we go next and how do we get there? And again, thinking about unions in their typical form of being able to wield collective power, I think that we do need a little bit of shift overall in unions all across the country, a shift away from the current service model of unionism, where like your union is there to bargain a contract for you, but also we need a more robust rank and file type of unionism. So everyday workers within their
Greg, I think we lost your sound. You there?
Yeah, I'm losing it over here too. I hope he does. I know when I was talking with Greg a while back, he lost his internet signal completely. So if he doesn't rejoin in a few seconds here, we might need to move on to you, Betsy, and then I'm sure Greg will rejoin us as soon as he's able. We'll give another few seconds though, just in case.
Can you all hear me?
There you are, Greg. We lost you for quite a while there, but you're back. So if you want to resume, we'll let you talk.
Yep, I will wrap up here as long as everyone can hear me. I apologize for that. My connection appears to be fine, but yeah, that's why I had to turn off my video. So yeah, where do we go next? Thinking about unions as vehicles that can wield collective power, I think that we need to move from that service model of unionism towards a more rank and file approach, meaning everyday workers fighting alongside with union leadership and organizing from the bottom up. We know that single payer is widely popular among working people. When there are even Fox News polls that show that 70% of Americans support this, that's an exciting fact. Just thinking about the amount of solidarity that people can have with each other in America that cut across racial lines, that cut across class lines, that cut across geographic lines and political lines as well. I think that Medicare for all and single payer healthcare is a fight that really can bring people together in that way. And I think one of the most natural ways for that to happen is through unions. In addition to that, the last thing that I'll add is that, we need to pass the PRO Act. That would be the biggest piece of labor legislation that's passed in several decades. And, when we talk about building stronger unions that can fight for something like Medicare for all, we need the PRO Act. We need to do away with right to work laws. We need to make it easier for unorganized workers to be able to organize. So yeah, I hope everyone can still hear me. If anyone has any questions, I'd be happy to answer them. And if not, I can pass it to Betsy in a minute. All right, seeing one question here. Let me see, it looks like we have Christine asks, hold on. How do we get the union members to understand that just because they fight now to protect their health care, it does not give their children and grandchildren health care? Don't they want to fight for next generations? That absolutely is a great point. And yeah, that just speaks to how we need to think of this in terms of not just our own unions and our own locals, but in terms of solidarity with everyone. That's a great point and a great question, Christine. And if there aren't any other questions, I think I went over my 10 minutes. So I think I am going to pass it over to Betsy Coffia. Take it away, Betsy.
Thanks, Craig, and thanks to DSA and Michigan for Single Payer for the opportunity to join you all tonight. So my name is Betsy Coffia. I use she, her pronouns. I am an organizer here in Northern Lower Michigan, grew up in this area. I am also a Grand Traverse County Commissioner. I was elected in 2018, reelected in 2020. I do want to make sure to state out front that I am not speaking on behalf of the county or the board. I'm only speaking for myself, but that is a role I hold, and I believe part of why I was asked to come and talk tonight was because to speak to sort of this issue from a local government level. But before I do that, I'll just talk a little bit about why this issue is important to me personally. The idea that we should all have the dignity of being able to go to the doctor when we are sick, period. I don't currently belong to a union. I believe in unions, but I believe regardless of that membership or not, every human being needs to go to the doctor when they are sick. Every human being, your child, your grandparent, whomever it is, if they have a toothache, if they are dealing with some sort of chronic illness, we all just deserve the dignity to be able to go and make that appointment and not be struck with fear that we're not going to be able to afford the bill that will come after. I grew up here in Northern Michigan in a working class rural home. My mom still cleans houses for a living. She's in her 60s now, but she was cleaning when I was a young child. I'm one of 4 children. And you will not meet a harder working person than my mother, but we did not have health insurance, and we often could not go to the doctor when we were sick. I have vivid memories of 2 of my siblings who would get, one in particular, repeatedly getting ill, and you know, it was scary, and we were having to pinch pennies and figure out if we could go to the doctor. It left an impression on me, and here I am. I'm now 43 years old, and there are still many, many families and children in Northern Michigan and across this country who are in the same boat 4 decades later. That is unacceptable. It is immoral. And I believe, as Greg said before me and Eli before that, there's a lot of support for this. We all have bodies. We all need health care, right? And so it doesn't matter who you vote for or whether you vote at all. We probably all have stories of someone we love or ourselves who have needed health care and couldn't get it, or had to do a spaghetti dinner, or now it's GoFundMe is the biggest health care provider in the richest country in the world. Like, what are we doing? It's just really, really unacceptable. So I think from a personal perspective, I'm really passionate about supporting getting us to healthcare for all. The sooner the better. And I believe it really is a crossover issue. It doesn't matter your politics. I think that is something, if we can connect with people and their real stories and their real experiences and talk to them about our own, you can go a long way towards moving the needle. One of the questions that was asked tonight is, where do we go from here? And I really do think it's that talking to your neighbors, getting them, listening to their stories, getting them to sign on to this concept, and then pushing on your legislators, your lawmakers. My personal belief is no politician should get away with running for office without being asked where they stand on should people be able to go to the doctor when they are sick, yes or no. And then we can talk about the details of how to get there, but I think that has to be a baseline for state and federal level, certainly, because this is a decision that gets made, unfortunately, above my local level. But now I'll talk a little bit about county level government and local municipal government. Obviously, we don't have the legislating power. Eli talked about symbolic resolutions. We could pass a symbolic resolution. We don't have the legislating or governing power to change things from this current for-profit model. But what we do have is a lot of knowledge, and we have a lot of responsibility. We are elected primarily at the county commission to be fiscal guardians of the taxpayers' money. And we are making decisions about a multi-million-dollar budget. And one of the biggest costs that we have is personnel. And within that, one of the biggest costs is, in fact, healthcare. And so engaging with your local elected officials and showing them the numbers of how much less we would need to be spending, which could then be allocated elsewhere to provide services, if we no longer had to worry about shopping around for a healthcare plan every couple of years and the premiums going up, et cetera, you could talk fiscal sense to a lot of very conservative county commissioners, which here up north, that is a lot of folks. If you show them the numbers, right? And then I believe the next step could potentially be they have ostensibly relationships with their state and federal lawmakers. And if a county commissioner, a city commissioner, a mayor picks up the phone to speak to their state or federal representative and says, you know, I really think we should take a look at this. This is how much money this will save for a local government. They might get a hearing in a way that, you know, Joe Public wouldn't necessarily get that legislator to pick up the phone right away. So there are some ways that you can engage with local government. And I think focusing on the fiscal side when you're talking to county commissions, for example, is a big part of that. And then again, personally, I think that the more that we are deeply listening to other people's stories, everybody's got a healthcare story themselves with someone they love, and then sharing your own, and then showing them the numbers, but starting with the heart. I think that is a key to moving us forward. And Greg talked about that there's an opportunity to really bring people together in a very divided time. I think this is very much a heart issue. We have people we love. We don't want to see them suffer unnecessarily, and we don't want to see them stressed out and going bankrupt because they got sick, right? I have short remarks tonight, but those were the things that I wanted to just share from a personal level. And then as an elected official, I think that there are ways that you can engage with your local government and get them on board, really, especially looking at how much money they would save if they were not having to spend such a large part of the budget on private healthcare plans. So that's really what I have to offer tonight. I'm happy to answer questions. I can look in the chat if there are some over here. Let's see. So Christine, I saw. Looks like unless there are any questions, I think I can introduce Jacqueline Williston, who is the co-chair of the Northern Michigan DSA. All you, Jackie.
Thank you, Betsy. Thank you for being here, everybody. Like Betsy said, I'm Jackie. I'm the co-chair of the Northern Michigan Democratic Socialists of America, or NMDSA, if you want to shorten that up. And I'm here today because I see our health as a political issue. It's connected to our jobs, our environment, our access to basic social needs. The United States has some of the worst healthcare outcomes in the developed world. We have the highest maternal mortality rate, infant mortality rate, rates of chronic preventable disease, and heart disease rates of any rich country in the world. And yet we have some of the most expensive healthcare in the world. You know, this doesn't make sense. You know, this is a product of something wrong with our larger social and political system. The soaring cost of healthcare explains more than any other single factor why so many Americans are so unhealthy. Even if you manage to avoid dangerous working conditions or environmental hazards, around here we know about PFAS that are in our water systems, in our wells. In this country, maintaining our health depends on our access to health insurance. You know, but unfortunately, nearly 30 million Americans are uninsured and another 30 million are underinsured. I know I signed up for insurance through the healthcare marketplace when it first came up, and I had to sign up for the cheapest option, which was the only option that I could possibly even consider affording. And it had the highest deductibles. And if I had had any kind of serious health emergency, there was no way I was going to be able to pay for it. You know, many Americans are like me, unable to get needed medications or regular checkups. We have to live by that finger crossed, I hope I'm not dying method. And that's not okay. It's time for a change. You know, that means in this country, our health depends less on our personal choices, our lifestyle, our biology. Instead, our health is determined by social conditions. our working conditions, our housing conditions, our environmental conditions, the local for-profit healthcare systems in our area. Around here, I only have one choice of where I'm going to go if I have a health emergency. You know, that is effectively a monopoly up here. Medicare for all is something I'm very passionate about because when I became pregnant with my daughter, I was really fortunate and able to get Medicaid. And for the first time in my adult life, I was able to access medical care without having to worry about if I was going to be able to afford it. And it was really fortunate because I ended up having an emergency C-section. And at no point did I have to think, am I going to be able to afford this? When I was making, you know, critical health decisions about my daughter and my life. If I didn't have Medicaid in Michigan, it would have cost me about $15,000 for that C-section. And that's just for my C-section. That's not including my care in the hospital, my medications, the care my daughter received. I didn't have to pay a cent because I was on Medicaid. I know having access to Medicaid changed my life, and it changed the life of my daughter. And I want that for every American. When our healthcare is a for-profit system, the incentive is to pay out as little as possible and give as little as possible care so that companies, health insurance companies, can make the most money possible. We've all heard the stories, it's been mentioned multiple times in here, of sick Americans, you know, having to fight insurance companies for necessary procedures that their doctors know are necessary. And, you know, as well as, you know, when you're dealing with life-threatening illnesses, the last thing you should have to do is be fighting on the phone with your insurance company, you know. And then the other issue is that we have to go on GoFundMe and raise a bunch of money for people to get necessary things. And it's depressing when every time you come on Facebook, you have to see, you know, a lot of them are children trying to get necessary health care. You know, GoFundMe was not started for funding healthcare. And I'm going to mention again the statistic of 70% of Americans support Medicare for all. I know we're all here in Northern Michigan, and it really feels like that's not the reality, but it has broad support across the political spectrum. I think it's even like around 25% of the Republicans support Medicare for all, or some form of that. It's an issue that Democrats win on. In 2020, a lot of the Democrats who were running on pro-Medicare for all platforms were winners. And those who didn't support it, not winning so much. I have an infographic that I could share on that at some point. Maybe I can put it in the chat or something. But Medicare for all is winnable. And it is a major step to a better future for every American. When we win this, we are unshackling Americans from the medical debt, weighing them down and preventing them from getting in the streets and bringing about a better future for all of us and fighting for that better future. But it's just the first step. If we win Medicare for all, we need more doctors. We're going to need more nurses. And that means we need free higher education so that the brightest people among us can afford to become those doctors and nurses. Not just those who are privileged enough to be able to afford that education or tough enough to decide that they're going to spend the rest of their life paying off that educational loan. If we win Medicare for all, we need to fix the healthcare infrastructure. There are many Americans who cannot even physically access the healthcare they need. We need a national healthcare system so that everyone can access the healthcare that they need. We need a national healthcare system so that we can equitably distribute the healthcare in this country. If we eliminate profit from the healthcare, we can ensure healthcare providers and facilities exist in communities of color and rural communities. Through a publicly financed and administered system, we will be able to prioritize public health, early intervention, and prevention. We know the current healthcare system is deadly for poor Americans and BIPOC Americans, especially Black and brown mothers and children. We need to create a healthcare system that listens to and honors BIPOC patients so that we have equitable healthcare outcomes. We also need to talk about Big Pharma, everyone's favorite friend to hate on. This piecemeal system of so many different health insurance companies negotiating with different drug companies, basically, we end up as the consumers losing and paying more than necessary. When all patients are under one system, the payer, we, the consumers, we yield a lot of power and can negotiate better prices. An example of this is that the VA system, they get a 40% discount on drugs because they have such a huge buying power and are able to negotiate those lower prices. You know, and this is also that buying power and that ability to negotiate is one of the main reasons other countries, drug prices are so much lower than ours. And this is why Big Pharma doesn't want us to have Medicare for all. And lastly, I just want to go over what the Democratic Socialists of America, what we want to see in a Medicare for all plan, which is comprehensive coverage. All services requiring a medical professional should be fully covered. It should be free at the point of service. All healthcare costs should be financed through taxes based on income. We need to get the Bezos of this country out there paying their fair share. And you know, that means no out-of-pocket costs for the American people going there to get our healthcare. And coverage for all U.S. residents. If you are in this country, you're a resident of this country, you should be able to access healthcare, whether or not you have citizenship. And finally, most importantly, we need to help those who might be financially displaced from changing to the Medicare for all system. There needs to be a jobs program. There needs to be training. There needs to be some sort of support for people who might be losing their jobs because of it. And that's what I got. Boom, boom, boom. Thank y'all. If there's any questions, I'll check here. Let's see. Someone says close to 50% of Republicans. Awesome. Eli says that. All right. Let's see any questions. So I think Paul here has some questions from people who registered for the panelists.
Yeah, we have a list of questions here, and I thought I would read off one at a time and just leave it for whichever one of you wants to address it. And we'll go through as many as we can. I guess one question I have here is, won't Medicare for all just be another bureaucracy? Who would like to take that question?
I can, if you, and other people can jump in too. The best way to answer that is that we've got a bureaucracy right now. It's called Blue Cross Blue Shield. It's called Aetna. It's called Cigna. It's called United Health. Only these bureaucracies are number one, much less efficient because they are built in a way their sole purpose is not to pay for and deliver healthcare. Their sole purpose is to make money for their organization. And so there are whole departments of these insurance companies whose job it is to deny claims. And there's a lot that we don't know about what goes on inside these corporations, but we do know some from whistleblowers, and we know that in some cases denial is as much as 20% with United Health. Essentially, people are told you get a bonus for making sure you reject every fifth claim that comes in. And the overhead, in other words, the money that is spent on things other than healthcare is anywhere from 10 to over 20% overhead. So in other words, when you pay that premium to Aetna or United Health or whatever, when you're paying that premium, when your employer pays that premium, when your union pays that premium, you that money's not necessarily going to pay doctors or hospitals. A lot of it's going to pay this bureaucracy. Medicare, on the other hand, has an administrative overhead of roughly 2%, so far less. And this is one of the ways in which converting everything to Medicare itself actually saves money. It pays for itself. You're cutting anywhere from 8 to 18 or 20% of administrative costs off the top. And as far as creating, new bureaucracy, I mean, look, guys, people who are watching this, 40 to 43% of this country's residents are already get their health care paid for through some form of single payer, whether it's Medicare, Medicaid, TRICARE, veterans, and so on. So it's not like we don't already have a really big bureaucracy. It's not like, we have a really tiny bureaucracy right now, but if we pass this, we'll have a big bureaucracy. We already have a big bureaucracy. So that's like, put that to bed. That's not a concern. I don't know if other people want to jump in on that.
I'll just add that, no, I really agree with what you're saying, Eli, and I do need to be off camera at this point, but I will just add that streamlining it to have one system managing this, the biggest thing to me is taking away the profit motive. They're looking for ways to make as much money off of people needing healthcare, and the private health insurance companies are looking for any reason to deny care. You can take that completely out of the equation by going to single payer. Healthcare should not be for profit, period. And so I just think streamlining it to one system, taking away the profit motive, allows it to be humane. And the doctors I've talked to, they hate having to deal with the fight with the insurance company to get their patient just basic needed care. So removing that out of the equation as well, and just having a system where people get the care they need, we all pay for it together, and we're not making CEOs of, insert private health insurance company here, mega rich so they can buy another yacht. I mean, sign me up. Let's go there with that bureaucracy.
Thank you on that question. I'm going to pick another question here from the series of questions that we received prior to the webinar. How is single payer able to cover healthcare along with extras such as dental and vision, long-term care, etc., and do it at less cost?
I mean, I think, and again, Eli or Betsy or Jackie can jump in here. I think that anyone who's ever tried to navigate, the healthcare system on top of, paying for dental bills and, anyone with mental health needs, I work as a mental health professional and, work with a lot of families who have difficulties covering that, within a for-profit system as well. So I think that with the efficiencies that could be gained from the Medicare for All single payer system, getting rid of that private insurance overhead. I think that's, again, in reference to that last question, I think that's a huge piece. Getting rid of that waste in the healthcare system could help with the savings there as well. But
Yeah, I mean, one thing to add on to that is, yeah, it's absolutely, it's the efficiency Betsy was talking about, having one system. But also within the Medicare for all bills, what they have built in is what they call global budgeting. You know, one of the concerns would be, well, if Uncle Sam is just going to reimburse hospitals for every single MRI, knee replacement, open heart surgery, you know, whatever, you know, why not just charge $200,000 for an MRI? You know, give somebody a Band-Aid. Uncle Sam's paying for it. That's a $5,000 Band-Aid. And very quickly the hospitals will just, you know, bankrupt the whole country or something like that. And the reality is actually that is kind of happening right now with the private insurance. That's why sometimes you get these absurd and horrifying situations where, you know, somebody's toddler bumps their head on the coffee table and they're worried that the swelling's not going down, so they take them to the ER and they tell them they're fine, no concussion, give them an ice pack and some children's Tylenol, and then submit a bill for, you know, $18,000 to their insurance company, you know, and then which gets rejected, and then so the hospital bills some poor family, you know, $18,000 for an ice pack and children's Tylenol, you know, because it's this game that they play with the private insurance companies. It's like, maybe they'll pay us $18,000 for an ice pack and children's Tylenol, or maybe they won't, in which case the patients will pay. What do we care? It's this very cynical game that goes on, and it shows why this like idea of like the free market and stuff doesn't work at all in healthcare. But what the Medicare for all bills have is global budgeting, and actually the state of Maryland does this already, so we know it works. They basically say to a hospital, look, we're going to give you a budget, like an allowance, you know, $200 million for the year. That should be enough, you know, unless there's some, you know, huge pandemic or some horrible event or something. But like that aside, we'll deal with that if that happens. But on an average year, you should be spending around $200 million. And they have these formulas and ways of figuring that out. So no, don't, you know, if you're getting money, don't spend it all on a new beautiful atrium or a swimming pool for your corporate executives. I mean, just, you know, like, you know, if you know, bill like Uncle Sam, you know, $25,000 for every Band-Aid, you're gonna blow through your budget by March. Then you're gonna have to like start selling your parking lot or something to pay, because we're not going to reimburse you anymore. So it forces hospitals and providers to be more disciplined, and that's one of the ways it saves costs. And you know. The other thing too is like, so much of our healthcare is done completely backwards. And you talk to any doctor and they'll tell you like, if they had a dime for every person who came in and like end stage diabetes, because they absolutely had, because they were dying, so they had to go see somebody, but they refused to go at any stage along the progression of their disease. You know, because they couldn't afford it. They couldn't afford the $50 copay. They couldn't afford, they didn't have insurance. I mean, you know, it's a lot more expensive to treat somebody in full kidney failure, you know, than it is when they're pre-diabetic, and to work with them that way. So there's all kinds of ways in which there's savings built into the system. And the last thing I'll say is like, it's not just the country that will save money. 95% of us, unless you're in the very top percentile of income, you're going to save money. I mean, if you're, you know, upper middle class, you might be saving on the score of like hundreds of dollars a year. But if you're, you know, right in the middle, median income, household income is 55,000 in this country and in this state, you're saving probably $4,000 to $5,000 a year.
Okay, I'm going to find another question here in the pool of questions that we have. Won't Medicare for all lead to long wait times and rationing of care?
Yeah, I'd like to say on this one, I think the big thing is like we already have rationing of care. We just don't see it because nobody goes into the doctor when they're sick. If you're poor and you can't afford it, those people, like Eli was just talking about, they just don't go in and they wait until it's basically too late. They're too sick. It's gonna cost even more money. You know, so that's a huge thing. You know, I always say my wait time is infinity because I'm not even going to the doctor. You know, any wait time would not be bad for me. But at the same time, you know, that's kind of a fallacy. There's not, you know, that's really an issue of capacity. And, you know, if there are longer wait times, it's obviously because we need, you know, more facilities, more doctors, more nurses. It's not so much an issue of Medicaid.
I see a question or a comment from Christine Ostala, who says, whoever decided that our minds, our teeth, our eyes, our ears were not part of our health care. We are brainwashed to believe they can't be covered. Of course, we can figure out whole body coverage. Only for-profit lobbyists feed us that BS that we can't figure it out. We can care about each other to this level. It will work. I don't hear anybody disagreeing or arguing with that, so I'll find the next question. Is it possible for a private insurance plan to run out of funds if the claims are catastrophic? What protections exist if an insurance plan underpays its promised benefits?
Sorry, could you read that one more time, Paul?
Sure. Hold on just a second. Let me get back to it. Is it possible for a private insurance plan to run out of funds if the claims are catastrophic? What protections exist if an insurance plan underpays its promised benefits?
That's a good question. I don't actually know the answer to that. I think that there may be small insurers that have this issue, and there are times when there are businesses or unions that self-insure. But in terms of the big ones, you know, the Aflac and Blue Cross and United Health, they are so far away from running out of money. I mean, again, they're the second biggest. They have more money than like a lot of these, like oil and gas, than you know the financial sector, than Silicon Valley even. I mean, it's hard to imagine whatever scenario would cause such catastrophe that they wouldn't be able to honor their claims. I think our problems would probably be a lot bigger than worrying about whether or not Blue Cross Blue Shield is going to go under or not. Like that'd be like alien invasion level catastrophe. So I don't know really the answer to that beyond that. But I will also say though that again, like, you know, it's one of these things where if that were to pass, I'm sure the government would come up with some kind of bailout, which is single payer. I mean, it's just the worst of both worlds. So now the government is paying for everything, but they're funneling it through, private insurance companies who are just keeping us, a chunk of it for themselves, which is frankly essentially kind of what Obamacare is at this point, and with the subsidies. And that seems to be the big hurdle that some Democrats like Nancy Pelosi need to get over. Yes, this idea that the best way to deliver health insurance is for taxpayers to give money to Aetna, which will then keep a lot of it for themselves and maybe pass it on to consumers or not.
Here's a good question. How might a national health plan benefit our American industries that compete internationally with foreign companies? I guess I would add to that. Oh, Greg, you can answer. I'm sorry.
I don't know how well I can answer that question, besides to say that as someone who considers himself an internationalist, I hope that we could live in a world someday where every country has some form of single payer, and that countries don't need to compete against each other for with healthcare costs and between industries.
It's a huge disadvantage. I mean, the cost of employee healthcare is baked into prices. So once again, like Greg was talking about, you have to make up that difference. If you're going to offer healthcare to your employees, then you have to make up that difference with either higher product prices or lower wages. Otherwise, or you have to get, tariffs. I mean, it really becomes one way or another, like it's screwing people over, and the taxpayers are footing the bill anyway.
How are we doing on time? I'm showing about, I don't know, 8 minutes after 8. I'll maybe give another couple of questions and then see where we're at. How does everybody feel about that?
I think maybe we could do maybe one more question. Then I think we had a little bit of information to wrap it up and send people away with some next steps.
Oh, sounds good. Under a single payer or a Medicare for all system, will this put the government between me and my healthcare provider?
So right now, you have like a private company between you and your healthcare provider, and I think Betsy brought it up. Doctors are sick of having to deal with the insurance company and argue for their patients. They shouldn't have to deal with that. They think something's necessary. They should just be able to do it and bill the government, and the government pays that for people. We're already we already have a middleman, and that middleman cares more about money than he does your life. So I'd like to change that middleman first.
Yeah, that question, it makes me think a little bit about how some people criticize single payer healthcare by saying, it'll like they'll lose their doctor, that the government will come between them and their current healthcare. But I think that Medicare for all or single payer healthcare will go the extra mile of, making it easier for people to choose, which doctor they go to. I mean, I think not having to worry about in-network versus out-of-network type of care, I think could be a huge boon to people looking to have more choice in their healthcare.
Okay, that's the questions that I have. If you folks want to wrap it up with your final comments, I guess, Eli, would you be interested in wrapping up with your final comments? And then we'll let it go to Greg. And then after Greg, Betsy, and then Jackie can end it for everybody.
Yeah, well, just thanks so much for having me on. I just want to say, this is one of those completely absurd parts of the way our country has developed, of how capitalism has warped our democracy, for lack of a better way of putting it. Because like I said, over 50% of Republicans want this. When we knock on doors, this is not a partisan issue. This is there's sort of two worlds. There's the world of people who are like powerful and on TV and constantly on Twitter and this and that and involved, and and then there's pretty much 95% of everybody else who are just living their lives. And all of those people have problems with healthcare. Like Betsy said, everybody's got a healthcare story. When you get out on the doors and invite you to, join up with Michigan for Single Payer or DSA, go table, go knock on doors, everybody has a story to tell. It doesn't matter if they're a liberal Democrat or if they've got a big Trump, don't tread on me, Confederate flag thing going on in their front yard. They all do. I mean, we had a conversation with a guy who was he was probably a white supremacist. I mean, he was a hardcore Trump supporter dude. But he said he would support single payer, maybe with a few, qualifications, like no illegals, as he put it, getting it. But because his dad owned his own business all his life, was never able to, stopped being able to afford to pay himself health insurance, and decided to just wing it because he was 63 and figured, what could happen in 2 years if he just kind of went without insurance for a couple of years. And what happened is he had a massive heart attack and had a emergency open heart surgery, and which went for like 7 hours, and he didn't make it. He died on the operating table, and the bill was $300,000, and they give that to your next of kin. And if you die, it's not like they just eat the costs. Somebody's got to pay for it. So everything he worked for his whole life, this guy's mom, they were ruined financially. They were destitute. This happens to Trump supporters. It happens to people who don't vote. It happens to Democrats. It happens to everybody. And so this should be a no-brainer. It should be a powerful, populist movement. It is not a right versus left thing, actually. And it's a perfect gateway to convert people who are either apolitical or maybe more moderate or even right-wing to the idea that, no, the free market doesn't solve all problems. There's certain things we absolutely need to do collectively, that we need to solve collectively.
Yeah, I think that to wrap up, I'll sort of echo Eli. I know Eli earlier in his talk mentioned the concept of deep canvassing, like just having conversations with people on a really close personal level. We've talked about how Medicare for all and single payer healthcare really can bridge a lot of divides. And whether someone is very right wing, a Trump supporter, a different flavor of conservative, or a liberal, or someone even more farther on the left, many of us have this in common and need this greatly in our lives, for our health, for our well-being, for those of our loved ones. So I think that just having those personal conversations, starting with family members and then moving that into the workplace, when I've talked about the importance of labor in this movement, again, whether it's individual personal relationships in our personal lives or our experiences with people in our own workplace, building those relationships so that when we're all on the same page, we can really be in a position to utilize that power and fight for single payer.
I will go next here because Betsy has to leave the meeting here, unfortunately. But I guess I'll just wrap it up with saying, repeating what everyone else is saying. This is a winning issue. This is something that crosses the divide. Every American, or the majority of Americans, understand the morality that everyone needs healthcare and should be able to access healthcare, whether or not you can afford it. So I'll just end on that point. We dropped some links in the chat there if you'd like to sign up to help out with Michigan for Single Payer or Northern Michigan Democratic Socialists of America. And we also, the Medicare for All group has a meeting coming up in person up here in Northern Michigan. It'll be in Traverse City at F&M Park. It will also connect via Zoom too, so everyone can attend, whether or not you are in Traverse City. And I apologize, my 5-year-old is over here making all kinds of noise and things. So But that will be, I believe is it July 15th, Greg or Paul, at F&M Park in Traverse City?
Yep. So we have it tentatively scheduled for July 15th, which is a Thursday at 6 o'clock at F&M Park. And so, yeah, everyone keep an eye out for a more formal invitation to that. And yeah, I believe we got consent from people to share their emails. So yeah, keep an eye on your inboxes for that.
Okay, it looks like we're wrapped up, and thank you panelists for a very good discussion on single payer and Medicare for all. We have this video captured on our YouTube channel, and I've shown the link inside of the chat, and we'll also be sharing the link out later so that people can watch it in their homes at their convenience. So thank you, everybody. This ends the program, and we hope you have a good evening.
Thanks, everybody.
Bye.
Bye.